Hello, my name is Vikisha Fripp, and I'm a board-certified plastic and reconstructive surgeon in our nation's capital, Washington, D.C. Amoena has asked that I share my opinions and experiences with scars, specifically scars related to breast reconstruction. Scarring can be debilitating. It's a real issue for surgeons because scars can distort the surgical results. Scars are what patients see when they look in the mirror. But it's not only aesthetics, it's the functional limitation that scarring brings. Scars can limit movement, it can limit a patient's choices in garments and clothing, and it can also decrease a patient's self-esteem. After breast reconstruction, the scars typically occur around the incisions, and that's why we use the term incisional scars. These scars can be thick, they can be dark and raised, they can also cause burning and itching and even pain. It is incredibly important to do everything possible to prevent scar formation before it begins. For surgeons, scar prevention begins preoperatively when we talk to the patients about their history. Do they have a history of scarring? Do they have a history of keloids? That's important for us. Intraoperatively, scar formation is prevented by the gentle handling of the tissues. We also keep this in mind when we choose the dressings that will apply after surgery and also the garments that patients will be placed in. The dressings should provide moisture to the wound, and the garments should supply support. And that's why when we choose post-operative garments, we're looking for garments that are soft but yet supportive, and garments that allow the patient to continue to engage in their activities of daily living, so the garment should be able to move with the patient and not be restrictive and not apply pressure onto the wounds or the incisions themselves. The need for moisture is why I add on the anti-scar agents to this regimen. After the dressings are removed, the patients have bacitracin ointment applied to the incision until it's healed. At 4 to 6 weeks, I begin the anti-scar regimen for my patients. If there is a sign earlier that the patient is starting to scar, then I start these agents earlier as well. The anti-scar agents that I use in my practice range from topical liquids and creams to silicone sheetings that we apply directly over the incision. Now, these are the non-invasive methods that I use to treat scars. The patients are advised that the best results are when they are compliant, and that is stick with the regimen. Do not alter it at all unless you speak with your surgeon. It is also important to speak with your surgeon before you start any regimen, because you do not want to start too early and you do not want to be using the wrong products. It is important for you to know that we are on this journey with you. And it is our goal to restore you to the form you were before and in an even better way. Thank you for listening to my opinions. I look forward to seeing you in person hopefully one day. Until then, be well.